Hi, this is Adam. Before I begin, I'd just like to make a small disclaimer. I am not a doctor. This is not medical advice, and I certainly have no intention of putting out false or misinformation. You should probably do your own research and look these things up on your own. I am, however, an independent research analyst, and I work in the field of biological sciences and regenerative medicine. Guess the question on everybody's mind is what's up with the severity of this coronavirus? Why is it still causing such a panic? We all know now that, like, most people that get infected will only have mild to moderate symptoms like a cold, flu, fever, stuff like that. There are, however, a small subsection of people that will be affected more severely and possibly even causing death. It's been established that most of these people that fall under that range are either old or immune compromised and people that have pre-existing conditions. Um, Most hospitals that have had been dealing with COVID cases have detailed that most people that have died from COVID infection have secondary or sorry have pre-existing condition. I think mostly cardiac issues and diabetes are on top of that list. Besides, so there are still people that are dying that we need to address. Right? How do we stop this from happening? Also, what's a little more alarming is that the CDC has just released a list of secondary symptoms. We all knew that this is a respiratory illness and it just affects the lungs and the respiratory system. But yeah, these secondary symptoms are fatigue, aches and chills, headache, diarrhea, vomiting, nausea, dizziness, loss of taste and smell. Loss of taste and smell I can understand, like when you just have a cold or a flu, like you can't smell or taste anything, so that's normal. But all of these other things, like, wow, that's disturbing, right? What's even more disturbing is the fact that it's supposed to be a respiratory disease. So why is all of these things happening? How does a virus that affects the lungs go and cause all of these gastric issues and other things? I started off by looking at the treatment protocols that have been suggested by the CDC, and the medications and drugs that the CDC has mandated are hydroxychloroquine in first line of treatment, then ritonavir and lopinavir, which is given together, and then some other drugs like tocilizumab, corticosteroids, remdesivir, and a couple of other drugs which are still under clinical trials. Yeah. So now these drugs, ritonavir and hydroxychloroquine mostly, are very, very strong antivirals. Hydroxychloroquine is used for malaria. We already know that. So what are the side effects of hydroxychloroquine? The side effects of hydroxychloroquine are headache, dizziness, nausea, vomiting, stomachache, loss of appetite, and secondary symptoms like skin rash, itching, hair loss, irritability, nervousness. I'm sure those are extreme conditions. Side effects of ritonavir: nausea, vomiting, stomachache, diarrhea, feeling weak and tired. Also possibly numbness, rash, and tingling, which is again extreme conditions. Lopinavir side effects include diarrhea, headache, nausea, vomiting, stomachache, dizziness, drowsiness, trouble sleeping, bad taste in the mouth, and complications for diabetics. Similarly, cardiac patients also would have certain complications or contraindications with some of these drugs. Also, if you're a cardiac patient, you probably are on some drugs which are given to you for cardiac dilation, which are ACE inhibitors and angiotensin receptor blockers. These if you're on ACE inhibitors, you are more prone to be infected by by the SARS-CoV-2 virus, and also it increases your chances of severe infection. Now, the reason for this is that ACE inhibitors inhibit the ACE enzyme, which inadvertently creates an upregulation of ACE2, and ACE2 receptors on the human cell is the entry point for COVID-19. So if you are a cardiac patient and you are on any drugs that have actions of this sort, you should probably talk to your doctor and see if you can get a substitute or get out of these. Also, other drugs that are being given to patients at the hospitals treating coronavirus are tocilizumab and corticosteroids, both of which are immune suppressants. Yes, they suppress the immune system. That seems really odd, right? Why would they do that? But of course, there's a warranty. It's kind of warranted. The reason they are giving immune suppressants to patients suffering from a viral infection is because if you are suffering from a viral infection, part of your immune cells your immune response is also releasing interleukins and cytokines, which causes inflammation and could possibly be damaging alveolar cells at the site of infection. So to avoid that, they're probably giving these immune suppressants, but nonetheless, it does compromise the immune system, right? So let's round up here what's going on. So you have a patient who is old and fragile. Probably already their bodies are weak because of being on long-term drugs, medication for diabetes, cardiac, or any other conditions. On top of that, they're suffering from severe stage viral infection, which is unknown to their body. Their immune system is already taxed. They're already weak, and then we're pumping them with these drugs, which are causing all of these horrible side effects. Also, that probably is also these drugs are also causing kidney failure, heart problems, cardiomyopathy, which are listed as complications for COVID-19. But is it at all possible that maybe it's not this virus that's causing all of these secondary symptoms and further weakening of the body leading to that, but it is the drugs that are doing that? Wouldn't it be a better mode of treatment to instead of these drugs that weaken the body more to such a large extent, instead to work on boosting the immune system and strengthening the body so that you can also help regenerate the tissue? Just a thought, guys. Again, do your own research, and if there's any doctors watching this, I'd love to know what you think about this. So like, share, subscribe for further updates, and please let me know what you think. Could this be the reason why the death rates are going up and not coming down? Stay safe, stay natural.